Work is well underway on the site of the new Institute of Translational Medicine in Birmingham. This world-class clinical research facility will be located in the original Queen Elizabeth Hospital in Edgbaston, next to the new Queen Elizabeth Hospital Birmingham and the University of Birmingham Medical School. The QE building will retain its existing stripped-back Art Deco facade, with the internal spaces reconfigured around a newly infilled courtyard. The project received planning permission in December 2013 and work commenced on site at the beginning of May 2014. The ITM is delivered by Birmingham Health Partners, which brings together the clinical, scientific and academic excellence of University Hospitals Birmingham NHS Foundation Trust, the University of Birmingham and Birmingham Children's Hospital NHS Foundation Trust, as well as the Department for Business Innovation and Skills. The ITM's vision is to use pioneering science to accelerate the delivery of personalised healthcare. It aims to cure disease and save lives by applying transformative science and technology and by educating and training the healthcare workforce. The Security and Fire Office is situated here on the ground floor of the ITM and will offer support to staff and visitors throughout the building. This corridor leads to the commercial hub, where there are offices housing 4 and 8 desks. Panning round, you are looking towards the main ITM reception, with admin offices to the left and commercial offices to the right-hand side. Off this corridor, still in the commercial hub, there are smaller 2-desk offices, but you'll see that the ceilings are high and there's plenty of natural light coming through the large 1930s-style windows. The originals have all been replaced with replica energy-efficient frames and panes in keeping with the architectural period, and they've been manufactured by the same company that installed the originals. Here the tour group is standing at the entrance of an 8-person office, with the camera panning round now towards the adjacent 4-person space. The old floors have been levelled to allow the new carpets, furniture and fittings to be installed once the rest of the building work is complete. Back on the corridor you can see the Security and Fire Office at the far end. This admin office, again looking across the central courtyard, will accommodate 4 members of staff. Outside, the corridor leads to the new boardroom, which you can see here. This will allow up to 20 people to gather for meetings, seminars or teaching sessions, and can provide an overflow to view what's taking place in the lecture theatre next door. Birmingham Health Partners have engaged the services of Glenn Howells Architects to design the ITM, with Vinci Construction building it. The design of the state-of-the-art facility sensitively reflects its architectural heritage and transforms that history into an iconic centre for translational medicine in Birmingham. The lobby area will have a reception facing the door, with a variety of seating on either side, as well as screens to display information about what's happening within the ITM. Anyone who visited the Queen Elizabeth Hospital will recognise the north entrance, better known as the Queen Mother's Bust entrance. The donor board will be placed within the reception area. This open plan area will be transformed into a cafe, which will be accessible to all staff, students and visitors to the ITM. The facility will provide seating for up to 80 people and will offer a relaxed working environment for clinicians, academics, methodologists and industry partners. This space will also support lectures, conferences and evening events. Here you're looking towards the old QE boardroom, which will now be used as a lecture theatre that will have capacity for up to 63 attendees. The state-of-the-art facilities will incorporate dual projection for conferences, with video conferencing facilities and the ability to stream lectures to other meeting areas on levels 1, 2, 4 and 5 of the ITM, as well as the Centre for Rare Disease resource room. This is another view of the cafe seating area at the front of the building. The kitchen and food prep area will be just off the seating area, overlooking the central courtyard towards the rear. Moving down this corridor, there are 4 desk offices off to one side, and as we reach the west ground area, we move into the ITM Clinical Research Facility, which is accessed through a general reception and waiting area, which you can see here. The ITM Clinical Research Facility will focus on early phase trials and increase capacity for patients entering into clinical trials, supported by the National Institute for Health Research, Wellcome Trust Birmingham Clinical Research Facility, which will provide the expertise and experience to deliver patient-orientated experimental medicine research. The ITM CRF reception will have seating for approximately 20 people waiting for outpatient consultations, admission to the day case unit or transport. Here you can see consulting rooms off the corridor to the left, with clinical support rooms to the right. The space we're looking into now is a staff room. Along the corridor there will be a sub-wait area for patients and a staff base. This will allow patients to be monitored by staff whilst waiting for appointments. The ITM Pharmacy Robot Room is situated at the end of this corridor. Inside, the technology will process electronic requests for prescriptions, then select the required medication and dosage ready for dispensing. This state-of-the-art technology will support error-free, efficient prescribing to support staff and improve the patient experience. This is the main corridor on level 1 of the ITM. There's still a lot of work underway in terms of boarding out the designated spaces and fixing the electrics. This corridor faces out on the right-hand side over Mindlesome Way towards Nuffield House. This corridor is on the west side of the first floor and has a number of offices overlooking the courtyard in the centre of the Queen Elizabeth Hospital building. This huge tangle of orange data cables is in the hub room on level 1 and will eventually transport thousands of pieces of information to support the groundbreaking work taking place within the ITM. This second floor corridor has offices off to the right, leading down to this open plan space which again is flooded with light from the many windows. Shared admin and office resources on this floor will support the staff working here. Looking down the length of the open plan area, the scale of the space is evident, offering a great opportunity for experts to work together, ultimately for the benefit of patient treatments and outcomes. This is a space in which staff can relax and use kitchen facilities. It will be kitted out with a sink, microwave, table, sofas and a TV, allowing them to take a break from their work in a purpose-built area. There's a similar room on level 1. Panning round, you can see how it links to the main open plan desk space. This space on the north side of the building is the larger of the 2 conference rooms, again mirroring facilities on level 1, and will house a large meeting table and chairs. Just next door, to the left of the group in this shot, there's a more compact conference room for smaller groups. The orange data cables you can see being fitted here will support the ITM's all-important IT infrastructure. To the left here, there are 4 so-called silence booths which will offer quiet working spaces for 1 or 2 people. Now we're on the 4th floor on the west side. Off the main corridor there are a number of cellular offices which will each accommodate 2 workstations. The high ceilings in the 1930s building give a sense of space and light, which is enhanced by the number of windows out on the main corridor. This bubble wrap is protecting 3 large cabinets that provide the data links in the IT hub room. This large open plan area will house a number of desks for integrated teams, meaning specialities can work collaboratively to reflect the multidisciplinary approach to treatment and research. Now the site tour moves into one of the adjacent meeting rooms. The 4th floor is similar in design to levels 1 and 2, but there will be fewer offices due to the structure of the building. The University of Birmingham laboratories will be located on level 5 of the ITM. Here in the write-up room off the main corridor there will be 2 desks for lab managers behind the partition, with a write-up area for 6 people in the foreground. This corridor leads to the main lab at the far end. Now we're entering the sample processing room, which is where the initial work is carried out. The air conditioning and heating system has yet to be installed, but much of the equipment has already been delivered to its final location, ready for the work to start. Now we're looking into the freezer room, a small area for storage of samples. Back onto the main corridor we head down to the main lab and go through to the room on the right, which is the tissue sample lab. In this area the work is fairly well progressed, with the walls boarded out and the heating and ventilation system already installed. Back in the main lab you can see how the space is taking shape. The lit up room at the far end is the DNA lab. Here from the inside you get another look back through to the main lab. This ductwork is at the corner of the main entrance to the labs. Colour schemes throughout the ITM have been carefully selected to support its brand recognition, staff and patient experience and wayfinding. Each level will have a thematic colour with complementary fixtures and fittings to create a unified, bespoke and professional facility.